Type 1 diabetes. The epidemiology for type 1 diabetes is 15 per 100,000 people. The prevalence of that is 9.5%. For this is children and adults as well. The distribution is males and females, white, black, Asian, and also Hispanics. For males, the incidence is 26.1 over 100,000 people. To females, 19.7 over 100,000. The mortality rate is 627 per 100,000 people. Some basic information. Pathophysiology is the physiology of abnormal states, specifically the functional changes that accompany a particular syndrome or disease. According to Mayo Health, type 1 diabetes occurs when some or all of the insulin-producing cells in the pancreas are destroyed. This leaves the patient with little or no insulin. Without insulin, sugar accumulates in the bloodstream rather than entering the cells. As a result, the body cannot use this glucose for energy. Some signs and symptoms are increased thirst, frequent urination, extreme hunger, unintended weight loss, irritability and mood changes, fatigue and weakness, and blurred vision. This is also from dehydration, and in children, they sometimes may wet their bed later on when they shouldn't be anymore. Risk factors are family history, genetics, age, and geography. Some complications are heart and blood vessel disease, nerve damage, kidney damage, eye damage, foot damage, skin and mouth conditions, and pregnancy complications. Specific lifestyle interventions prevention. To prevent these diabetes complications, keep your blood sugar, blood pressure, and cholesterol levels as close as you can to the numbers your doctor recommends. Don't smoke, be physically active, and eat a nutritious diet to help you reach or maintain a healthy weight. One way to prevent is preventing cognitive issues. Type 1 diabetes can lead to changes in brain function, leading to cognitive issues such as confusion and memory loss. Memory issues in a particular case can both be high blood sugar and low blood sugar, so steady blood sugar levels are important. It also helps prevent skin disorders, prevent eye problems such as diabetic retinopathy, can prevent teeth and gum issues. An important one is preventing heart disease and stroke, preventing kidney disease, preventing nerve damage, preventing sexual dysfunction, and also foot problems as mentioned before. To prevent foot problems, you clean your feet daily using warm water and mild soap. Specific lifestyle interventions for treatment. Taking insulin, carbohydrate, fat, and protein counting, frequent blood sugar monitoring, eating healthy foods, and exercising regularly and maintaining a healthy weight. Some diagnosis tests include glycated hemoglobin A1C test. This test indicates your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to the oxygen-carrying protein in red blood cells, which is hemoglobin. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests indicates diabetes. If that's not available, you can also do random blood sugar tests and fasting blood sugar tests. After the diagnosis, You'll visit your doctor regularly to discuss diabetes management. During these visits, the doctor will check your A1C levels. Your goal may vary depending on your age and vary by other factors. The American Diabetes Association generally recommends that A1C levels to be below 7%, which translates to an estimated average glucose of 154 milligrams per dose. Compared with repeated daily blood sugar tests, these levels indicate how well your diabetes treatment plan is working. An elevated A1C level may signal the need for a change in your insulin regimen, meal plan, or both. Some treatment, like I said, taking insulin will very well help. And those types of insulin are short-acting, regular insulin, rapid-acting insulin, intermediate-acting insulin, and long-acting insulin. You can have insulin by injections, an insulin pump, which is a device about the size of a cell phone on the outside of your body. There's also a wireless pump option. You can wear a pod that houses the insulin reservoir on your body, which has a tiny catheter that's inserted under your skin. This can be worn on your abdomen, lower back, or on a leg or arm. The program is done with a wireless device that communicates with the pod. Some other medications are high blood pressure medications, aspirin, or cholesterol-lowering drugs. You'll need to monitor your blood sugar daily, at least 4 times a day. Some healthy eating would be fruits, vegetables, and whole grains. Make sure you get a lot of physical activity. You'll have to be concerned with your driving, working, being pregnant, and being older. For future treatments, you may have to get a pancreas transplant or an islet cell transplant. Some barriers are personal barriers and environmental barriers. More barriers include school, friends, family, fear of complications, lack of information, personal characteristics, among others. In a study that was done, the objective was to determine in the adult population with type 1 diabetes some barriers to regular physical activity. The research and design methods for it was 100 adults with type 1 diabetes answered a questionnaire assessing perceived barriers to physical activity and related factors. Some results was fear of hypoglycemia. That was identified as being the strongest barrier to physical activity. Greater knowledge about insulin and using appropriate approaches to minimize exercise-induced hypoglycemia were factors associated with fewer perceived barriers. Greater barriers were positively correlated. Some conclusions was the fear of hypoglycemia is the strongest barrier to regular physical activity in adults with type 1 diabetes. Regular physical activity is associated with numerous benefits such as improved quality of life and decreased cardiovascular risk factors. This is also a benefit from mortality. In summarization, get plenty of vegetables, fruits, and whole grains. Choose non-fat dairy and lean meats. Limit foods that are high in sugar and fat. Remember that carbohydrates turn into sugar, so watch your carb intake. Below, I have a link. This is Healthy Lifestyle Tips. Within this link, it talks about eating healthy, exercising, getting checkups, managing stress. Stop smoking if you have been. Smoking can make it harder to exercise. It also can cause your heart disease, eye disease, stroke, kidney disease, blood vessel disease, nerve damage, and foot problems as well. If you smoke, your chances of getting these problems are even higher. You should also watch your alcohol. It may be easier to control your blood sugar if you don't get too much beer, wine, and liquor. So if you choose to drink, don't overdo it. You should check your blood sugar before you drink if you do, and take steps to avoid low blood sugars. If you use insulin or take drugs for your diabetes, eat when you're drinking. Some drinks like wine coolers may be higher in carbs, so take this into account when you drink them as well. Now here are my citations.